Hello, Melanie Eckersley of Eckersley Consultancy. You can use the HSE risk assessment template for risk assessing for COVID-19 or an existing risk assessment template that you have if it includes the relevant sections, which are the hazard, who can be harmed and how, current control measures, residual level of risk, and details of additional controls required. The hazard column should be used to look at specific issues and problems. For example, where you would usually consider the hazard to be using a ladder, for COVID-19 it will be issues such as transmission of COVID-19 through contaminated surfaces or transmission of COVID-19 between employees and customers. You can then go on to say who could be harmed and how. In the case of transmission of COVID-19 through contaminated surfaces, you could have employees and customers who come into contact with contaminated surfaces. Then you can look at the controls. So the controls in this example would be details of your cleaning regime and the adoption of good personal hygiene, hand washing and catching coughs and sneezes in a tissue. This may also include procedures for hand washing when entering the building. When considering the level of risk, you should really think about how the virus is transmitted and how likely that transmission would be following your control measures. Where all government guidance can be met, you may wish to record the risk as low. Where high levels of close contact are required but are controlled, you may wish to record the level of risk as medium. Where you cannot control the risk and actually the risk of transmission is high, you should record the level of risk as high. If this is the case, additional controls must be put in place. I would suggest that a high level of residual risk is unacceptable in these circumstances. You can then go on to record additional control measures that are required. But remember to implement these controls and move them into the current controls section. I hope you found this short video helpful. If you have any questions, please feel free to reach out to me. I'm always happy to help.